In this video, we will be discussing the teeth, palate, muscle tone, tongue, chewing, gum disease, and cavities within individuals with Down syndrome.
This is Angela. She is expecting a baby boy, Daniel. Angela has just found out that Daniel has a genetic disorder called Down syndrome. This condition is caused by an extra 21st chromosome and is characterized by developmental delays. Down syndrome manifests itself in various ways within the mouth, potentially causing significant oral health issues. The severity of the intellectual and physical delays associated with Down syndrome varies from moderate to severe. Each individual may experience differing dental deformities. Understanding these common dental abnormalities can promote guidance, prevention, and early intervention, promoting a higher quality of life. The size and overall stature of teeth of a person with Down syndrome is smaller and shorter than average. The roots are seen to have a condensed cone-like shape as well. Teeth may develop and erupt in unexpected sequences. In addition, it is not uncommon to have missing teeth, particularly the third molars and lateral incisors. Diastema, or large gaps between teeth, are also quite common and most seen between the central two incisors. Individuals with Down syndrome often demonstrate a unique shaped palate, known as a Gothic palate. The main characteristics include being high-vaulted, narrow, and V-shaped. These traits go along with having a smaller maxilla or upper jaw, underbite, and dysfunction of the jaw joint, leading to misalignment of the teeth. These irregular dental arches can affect swallowing, breathing, the chewing of food, as well as speech and articulation. A combination of lower muscle tone, referred to as muscular hypotonia, and neuromotor deficiencies causes the muscles of the face, noticeably the jaw, lips, and tongue, to be more relaxed in individuals with Down syndrome. This trait often leaves the mouth open, leading to dry mouth. Bacterial growth is encouraged in this environment, generating bad breath, chapped lips, and decreased tooth remineralization. The recurrent open mouth posture commonly leads to mouth breathing. This type of breathing is also caused by the smaller nasal bone and passage sign seen in individuals with Down syndrome. Another common trait of those with Down syndrome is a larger tongue, also known as macroglossia. However, this is a false macroglossia, where the tongue looks larger due to the smaller upper jaw and oral cavity. The tongue adapts to the small oral space by posturing itself forward. In addition, the tongue commonly displays large grooves and ridges, giving it its name, fissured tongue. These cracks often attract and collect debris and bacteria, also causing bad breath. Because of the factors listed previously, individuals with Down syndrome can struggle with chewing or as a baby sucking. The lower tone jaw muscles can tire more easily, while a misaligned bite makes chewing more of a challenge. Potential drooling is also due to the open and relaxed position of the lips. Tongue size may result in additional anxiety related to oral stimulation and cause a gagging reflex. Lastly, the shape of the palate and tongue predisposes food to retention within the palate. The most significant dental risk for individuals with Down syndrome, however, is periodontal disease, also known as gum disease. Because the immune system of a person with Down syndrome is more impaired than the average, people with Down syndrome do not have the same level of protection against the disease, leaving them more susceptible. This disease begins as frequent bleeding of the gums, moving to gingivitis, and progresses to periodontal disease. When this occurs, more of the tooth is exposed as the supporting bone is lost and the gum recedes. Remember that the roots of Down syndrome teeth are smaller in size. This causes them to be more prone to falling out or requiring a tooth extraction. Gum disease can be prevented by regular brushing, focusing on the gums. It is crucial to regularly attend your dentist for monitoring and assessment. If they can identify the problems early, they are often easier to treat. Those with Down syndrome are seen to be less susceptible to cavities than the average person, but still have a chance of getting them. This phenomenon has not yet been fully explained. One theory suggests it is a genetic characteristic, and individuals possessing more protective saliva with a higher flow around the teeth. Other possibilities include the factors of having a highly supervised diet. Lastly, it is believed to be due to the spacing between smaller-sized teeth, making it much easier to clean. Nonetheless, universal susceptibility to cavities depends on environmental factors such as diet and oral hygiene. Want to learn more? Please click on Part 2 to understand more oral health risks for individuals with Down syndrome.